Hey, it's Dr. Chase Lay. Hope you had a great Christmas holiday and a happy new year coming up. Just wanted to review with you again the difference between scheduling and timing. Now take this young lady, for instance, who had an infrabrow lift and anchoring technique for her crease. She's not even a week out. She looks really bruised and swollen, and she's probably still going to look bruised and swollen next week, even with her stitches out. Everything looks great as far as the shape is concerned, but this person is going to look pretty beefy, a little swollen and red for another few weeks, so that's not too strange. I just want to again go over the importance of understanding what timing is as a patient. Now, timing is something that you yourself as a patient has control over. You can try and have surgery 3 or 4 weeks before an important event, but usually that's not advisable. So if the way you look on Christmas morning or New Year's Eve is very important to you, don't count on surgery to have you looking perfect by that time. It doesn't matter if it's your daughter's graduation, your uncle's wedding, your best friend's birthday party, an anniversary. Scheduling is when the physician and their staff help you pick a day and a time. Timing is when you, the patient, decides when you're going to have surgery. So if there's some very important holiday, personal, or even professional event coming up, you might want to consider doing surgery after that, especially if it's within the first, say, 1 to 3 months before that event, maybe even 6 months, depending on how important it is to you. So hopefully that was helpful. That's the difference between scheduling and timing. I'm Dr. Chase Lay. See you soon.